Oral fluid collection. During this meeting, we're going to discuss the security and the integrity of the oral fluid collections. We're going to go over oral fluid collection device overview. So what it should look like when one gets approved.
Yeah.
We're going to go over the steps for the oral fluid collection, preparation, and then of course the steps of the oral fluid collection. We'll discuss also problem collections and fatal flaws. So security and integrity of the oral fluid collection is not different from what we're currently doing for urine specimens. We have to prevent unauthorized access, so we have to restrict access to the collection materials, to the specimens, and to the lab area, okay? We have to have limited access postings or signs in the facility, making sure that anyone that comes behind those doors from the lobby is because they're going to be tested, okay, or they're going to receive services. We want to make sure that the collectors understand that we can only handle one collection at a time, and that while the collection container is opened, it has to be kept within visual contact of both the donor and the collector, okay? And making sure that we also maintain control of the specimen and the chain of custody at all times until it has been sealed. So the oral fluid collection device has to have the capacity for 2 milliliters of oral fluid specimen, okay? It has to have a volume indicator that we can see when we've gotten enough specimen and the patient can remove it from their mouth. It has to be transparent. It has to come in a tamper-evident packaging, so each device has to be individually sealed. It has to contain an expiration date. It has to have the manufacturer's instructions. It has to come with a leak-resistant plastic bag, just like the urine does, that has 2 compartments, one for the collection and one for the paperwork, okay? And it also has to have absorbent material in case of leakage. The prototypes that we've been able to see, what you're going to put, or the donor is going to put one device into their mouth. And when we get the sufficient amount of volume, you'll be able to separate that swab into 2 pieces, one for bottle A and one for bottle B. That's what we've seen. We don't know if that's going to be the final device that's going to get actually approved. Okay. So what are the steps prior to the collection process? We want to make sure that you inspect the donor's mouth for items that could interfere or alter the specimen. So they should not have any mouthwash, mints, candy, gum. They cannot have been smoking at least 10 minutes before the collection, okay? If necessary, we're going to request the donor to lift their tongue or pull their cheeks away from the gum for a thorough inspection. We're going to have, if we notice that the donor has abnormally colored saliva, or if the donor claims that they have a dry mouth, you're going to allow a water rinse, okay? It's going to be 8 ounces of water. They can either rinse and spit it, or they can drink it, okay? And after that, we need to wait 10 minutes before we start the collection. During those 10 minutes, and that is not, those 10-minute wait time is not only for the dry mouth scenario, we need to have a 10-minute wait for all oral fluid collections, okay? So during those 10 minutes, I promise it's not going to be an awkward silence moment between you and the donor. During that time, we're going to make sure that we review the oral fluid collection procedures with the donor based on the device manufacturing instructions, okay? We're going to make sure we go over step 1 of the chain of custody, which is identifying the patient, marking the DOT agencies, making sure the collection site information is there. Then we're going to go ahead and complete step 2 of the chain of custody. We're going to make sure we mark that the specimen is going to be an oral fluid. Under the oral fluid split type is going to be subdivided, okay? And we need to make sure that we mark whether the device was within expiration date. I'm not sure if you've already seen new chain of custody forms. I just requested a couple of chain of custody DOT forms for our house account. And you can notice now on step 4, there is a space there that's also colored in yellow below our signature, where it's requesting the expiration date of the devices, okay? So that's where we're going to document the expiration date.
And then the new COC is just for the swabs, correct?
Well, it's going to be the same chain of custody
Well,
for
no, I'm talking
both
about
urine and
the expiration date.
it's for each device, exactly, for the device that you're going to be using.
Just for the swab, though, not for the
Just for the
UBS.
swab, not for the urine. Yeah,
Okay.
correct. Just for the swab. Once we complete that step, then we're going to have the donors wash their hands, dry them well. Or if you're in exam room, then you'll be able to use hand sanitizer as well. So either or, you can use soap and water or hand sanitizer before the collection process. And of course, making sure that the unwrapped collection device remains visible to both the collector and the donor until the specimen has been sealed. Okay, so all of that is pre-collection. So the collection process. All collections or all oral fluid collections are going to be, oh God, I forgot the word, observed. Okay, they're going to be, for all purposes of DOT, they are an observed collection because we're always going to be looking at the donor while they're completing the process. The collector has to be present during the whole time, including those 10 minutes, okay? You guys are not allowed to just give them the instructions, step away and do other things, and then come back after the 10 minutes. You have to be observing and documenting anything that happens within those 10 minutes. You need to make sure that the donor is following the manufacturer's instructions as to how to collect the specimen and where to put the device in their mouth. You have to verify the volume indicator. You have to inspect for tampering, okay? So this is if the swab is white and when it comes out of the donor mouth is brown or it's blue, green, or you notice that they've chewed on it. Those are clear attempts to alter the specimen, okay? So you need to be looking for those things and making sure that we document in the remark section of the chain of custody form, okay? How to prepare the specimen for the lab. Follow manufacturer's instructions, okay? Up to now, we don't know if this is going to be room temperature, if we're going to have to refrigerate the specimen, so we're going to follow the device's instructions, okay? We need to make sure, of course, that at least we have 1 milliliters of undiluted neat oral fluid in each bottle, in bottle A and bottle B. We have to put the tamper evidence seals and make sure that we are not covering the expiration date on the device with the tamper seals, okay? And make sure that you record as the collector the collection date and give the donor 4 initials on the specimen seals. So because these are observed collections, there's very few things that could happen or could go wrong or make these a problem collection. But there's 2 things. One is that we get an insufficient specimen, and the other one is that we have a tampering attempt, okay? So what is considered an insufficient specimen? The patient has had the device in their mouth for 15 minutes, and the volume indicator does not lit up, okay? So we don't have enough after 15 minutes of the donors having the device in their mouth. In those instances, we have to give another opportunity to the donor. And 2 things can happen. Either we can continue collecting a oral fluid specimen, or the employer can decide that they want us to switch and do an alternate specimen type, which would be urine, okay? In that instance, when we are changing to an alternate specimen type after an insufficient specimen, we're going to discard that chain of custody and we're going to start a new chain of custody with the specimen that we're going to start fresh, okay? Make sure that on that second chain of custody that you're going to start, you're going to document the situation on the remarks section. Now, if you are continuing with the oral fluid, you're going to continue the documentation on the same chain of custody. Only if you're changing from urine to oral or from oral to urine is that you're going to start a new chain of custody, okay? We're going to encourage the donor to drink up to 8 ounces of water, and we have to wait at least 10 minutes before we attempt to collect that second specimen, okay? They're going to have up to 1 hour to provide a sufficient amount of specimen. So it cuts the wait time from 3 hours with a shy bladder urine to 1 hour if it's an oral fluid collection.
Gotcha.
If after the 1 hour, we still do not have a sufficient amount of specimen, we're going to discontinue the collection. We're going to contact the DER, and we're going to complete the paperwork and send the copy to the DER and send the copy to the MRO. So there's one where the donor comes in, inadvertently has gum or was chewing gum or just smoked a cigarette or had those pads of Listerine or mouthwash in their mouth. If that's the case, we're going to ask them to remove it, and we're going to collect the specimen and continue with the collection process after the 10-minute wait. Okay.
Yep.
Now, if the donor brings in a commercial drug culture product, or they bring in a device that mimics what we would use to collect the specimen, we're going to terminate the collection. Fatal flaws. Most of these are exactly the same as with our urine specimens. If we do not send the chain of custody form, if we do not submit a specimen, if the collector's signature and print name is missing, if we collect two separate specimens but only send one chain of custody, that would be a fatal flaw. If there are any mismatch with the specimen ID numbers versus the chain of custody, if we have a broken seal or a tampered seal, if there's insufficient specimen volume to process, if we use an expired device, this is particularly for oral fluid collections, and if we're missing the expiration date of the device in the chain of custody. Now, in this case, it will only be a fatal flaw if you also covered with the tamper evidence seals the collection date on the device.
Gotcha.
If the lab has the opportunity to confirm that it was within the expiration date and it's visible, then it won't be a fatal flaw, okay? But if you did not document it and you also covered it with the tamper evidence seals, that's going to be a fatal flaw. Most of you that are here, you got a 9. You missed only one question, but we want to make sure everyone gets 100 because that one wrong question could lead to a fatal flaw. Okay, so we want to make sure we avoid those as much as possible. So after this short discussion, I hope you understand the procedure better. You know how to maintain the specimen integrity and the donor's privacy during the process. There are still going to be ongoing competency as urine collections. We have to get refresher training every 5 years. The only difference is that with DOT oral fluid collections, we have to do mocks and get certified on each device. So if DOT ends up approving 5 devices, we have to do mock testing for all 5 devices and get certified on each device. Okay, so that's a lot of work for us ahead, depending on how many devices they end up approving. And then, of course, we want you to make sure that you are able to confidently document the collection process.